I had the chance 2 or 3 years ago now to write the NHS Future Forum report on integrated care. And it was a good thing that we were looking at integrated care, but it was also a very uncomfortable and slightly depressing experience. And I revisited that as I was reading it again a fortnight ago, to see this litany of very well-meaning, very expensive failures of our attempts to establish integrated care. And it's not just us, it's internationally as well. And you look particularly at the attempts to build successful partnerships between all the different parts of a local system to try and deliver this kind of joined up care which we all want to deliver for people. And you see that that foundation of partnership is one of the most commonly absent things as we look back through the history. And I think what's really interesting and really encouraging for me, sort of looking around what's been happening through your transformation programs and the approach you've gone about it, is that you've achieved an awful lot more in less time than an awful lot of the international evidence of other people's work. And I think one of the very big reasons for that is that you've built a very different foundation. You've been encouraged to take the time to create this thing we call our shared purpose. And if you recall some of the workshops that you've been in, they, for some people, have frustratingly encouraged you to stop long enough for everyone around the system to describe where we're heading. Can we describe that? Can we make it attractive? Can we say how we know when we'll get there? Look to the future. But I think the second thing you've done, which is really impressive, is the next bit. You've acknowledged that that grand vision of the future isn't enough. You've got to make it real. You've got to connect it to the hearts, the minds and the work of the people who are doing that job day in and day out. I think CCGs have an incredible opportunity to affect change through being system leaders. But they are faced every day with the incredibly difficult challenge of the fact that most people they need to work differently don't work for you. It's a different order of challenge that you've set yourselves. But I think it's really, really encouraging, and you should be praised and you should celebrate the fact that you've done that and you've been going about that. And the foundation of our shared purpose is very intentionally at the heart of the NHS change model as a foundation or a centre of gravity, the golden thread that runs through everything else. So the time that you've spent and the effort and skill that you've brought to building that sense of who is the we? Who is it who's involved in this? The sharing, and then the energy and the purpose for change. Let's agree that we really do want to commit to getting there. I think that's one of the reasons why your work stands out as being quite different in the history of the health and care system. I think, though, that it's time to look forward a bit, and I'm going to set a couple of challenges for you about what next. And I think, in a sense, a lot of them have been set up really nicely in the NHS 5-year forward view. 2 things about it really stand out for me, 3 things I think, that are really encouraging. The first is a big renewed focus on the purpose of the health and care system being to improve the well-being of a population. And the second thing that's great is this talk of a new kind of relationship and partnership with citizens and with people who use our services. And the third, which is perhaps where the pain starts to kick in or some of the bigger nitty-gritty challenges arise, is in the emphasis on primary care at the heart of the system, but acknowledging that right now, primary care is not delivering its potential. And it's the responsibility of, I would argue, everyone in this room, as well as NHS England, to be part of helping to unpack some of that and liberate some of that potential. So as you think about some of the things that we've talked about in the 5-year forward view, here is a diagram illustrating what a multi-specialty community provider could look like and the sort of structurally who could be in there. And then here's a diagram illustrating what a primary and acute care system could look like. But we all know that those structures are only going to deliver what we hope. if the functions inside them are very different, if the model of care and the behaviours and the relationships between those different teams are really quite different. You keep coming up against this challenge of transforming primary care and how you go about doing it. I think this is the sharp point that we have ducked for a long, long time. If you look back over the last 10 years, how many initiatives in the NHS have sort of begun with a sentence, assuming general practice isn't part of the solution, how do we improve access for people who need urgent primary care? And we keep designing sort of bolt-on solutions and avoiding this very sharp point of, well, okay, can we get GP practices being part of the solution here? How would you do that? Are they ready? Are they willing? Are they able? I don't think we can any longer duck those questions. And that's a painful challenge, and it's one that, frankly, everyone everywhere in the world is struggling with. We published at NHS England a document at the beginning of last year, which was the emerging findings from our call to action on general practice. And we described these sort of 4 ambitions about the type of care we wanted patients to receive from primary care. We talked about the need to be more focused on health and wellbeing promotion, more responsive access to care, more consistently high quality, and then particularly for people with long-term and complex needs, much more holistic, personalised, proactive and coordinated care. And then we said, if that's the kind of future that, from the perspective of these teams, what's going to have to happen to those teams to deliver that? And part of the answer actually is in the 5-year forward view. We think that actually we're going to need wider teams, not just small individual GP practices, bigger. And secondly, not with a brick wall around general practice as though the medical model of primary care is the be and all end all. It needs to be a far wider collaborative way of working. But we've listed the development areas that we think would be necessary in order for these providers to rise to that challenge. And there's quite a lot of them. And some of them cover a multitude of, I won't say multitude of sins, but a multitude of challenges. You know, the small matter of a single record, one person, one record accessible by everybody. The small matter of the workforce, enough people, the right people, working as a multi-professional team. Small issues like that are going to be absolutely essential if we're to help unleash some of the potential that primary care definitely has to contribute to what you're seeking to do for your local people. So how can you do it? My 3 thoughts about how you might want to direct your attention are, firstly, what could be better aligned to help you get faster progress, particularly at provider level where patients were wanting to receive more of their care. Don't be satisfied with the list you've come up with already. Ask again. The second thing, I think, is we talk sometimes about the need for this to be a spiralling outwards, or some people prefer the metaphor of snowballing, that once you've got enough people on board to get started, start. Don't wait for every single person, every single stakeholder to be 100% committed and have written it in their own blood. Get enough people, get enough of an idea about where you're heading and then move, but then continually ask yourself, who else could we incorporate into the team? And then the third challenge actually is also a personal one, and it's about energy. Things don't happen within 3 weeks or 3 months, or usually even within 3 years. It's a longer timescale you're working to. However, within 3 years, an upsetting proportion of people run out of momentum. And I'm really helped myself by the 5 energies for change, and their reminder that we have a tendency, when energy drops off, to overuse some bits of the energy that will create momentum. And the 2 bits we most commonly overuse are the intellectual and the physical. An example would be, you have your next quarterly review meeting of your oversight group, your program board, whatever, and you say, we really momentum's falling off, what do we need to do? And usually 2 things are agreed. Firstly, let's just revisit the data. Let's take stock, let's find out where the gaps are, let's measure this, let's do it. And then the second is, let's work hard. Come on, just do it. That kind of physical energy, just be more busy. They're not wrong. It's just you also need to recharge the spiritual energy of seeing the purpose of this and the value to get more people on board. You need to look at the social energy of who we are, how we're connecting, who is the us. The nice thing is the evidence shows if you attend to all of those energies, then you don't have to fall victim to the 18-month to 3-year tail off. So I'm really pleased at how much you've done. Thank you. As John said, from a personal level, I can't quite believe so much has been achieved so consistently. Well done. I hope the rest of the day is a great opportunity for you to get into some of the detail of so what next, because this isn't about saying it's done. None of us have done it. It's about moving on. So thank you and good luck with the rest of the day. Good luck with the rest of your programs.